Canadians continue to roll up their sleeves for the COVID vaccine. Booster shots are now available for those who qualify, and children 5 to 11 will soon be getting inoculated. So it's a bit of a head scratcher why Ontario and Quebec have reversed their decision on mandatory vaccines for healthcare workers. They'll no longer be required to be vaccinated to continue to work in a healthcare setting. Will this lead to a rise in infections? Hello and welcome to the Unpublished Cafe. I'm Ed Hand. We're coming to you from a remote location and practicing physical distancing to enhance safety. Remember when the pandemic set in and turned healthcare upside down? Then you recall when a vaccine was approved and the healthcare sector was at the front of the line to get it, and they should have been. Many were relieved to be vaccinated to protect themselves, their families, and their patients. Ontario and Quebec both pledged to make those vaccines mandatory for healthcare workers, but they've reversed course, citing concern about losing those healthcare professionals and impact on the healthcare system. Not only has it had to deal with the pandemic, but it's pushed back treatments and other surgeries. And that's what this province or these provinces consider real world evidence. Our unpublished vote question asks, should healthcare workers be vaccinated against COVID to keep their jobs? Yes, no, or unsure. You can log on and vote right now at unpublished.vote. And have your voice heard. Coming up on the Unpublished Cafe, we'll talk to bioethicist Terry Bowman about it. But first, I am pleased to be joined by Ontario Liberal House Leader and MPP for Ottawa South, John Fraser. And John, you've been calling for mandatory vaccines for healthcare workers. What was your reaction and your party's reaction to the about face?
Well, yeah, it wasn't. It's actually interesting because it was, in some ways, was not an about face. What the government said was they made it mandatory for organizations to have policies. But the Premier just stepped back from actually doing that for all healthcare settings. They eventually did it in September for long-term care workers, and they've just recently refused to do it for hospitals. And it's really hard to understand because, I think it's reasonable for families to expect that, anyone who's caring for their son or daughter or their mom or dad at the bedside, that person's been vaccinated or in somebody's home. And so, and it's not like it's something new. This has been a requirement of people's employment, vaccinations in healthcare for a long time. And even the chief medical officer of health says it's a duty of every healthcare worker to get vaccinated. It's just the evidence is there. It protects people. And in actual fact, the argument the government uses against not making it mandatory doesn't hold water because they did it in long-term care. And they did it because the risk of outbreak is a greater risk to losing staff than mandatory vaccinations. And that's the minister himself said that. And you can just see in Ontario right now, I think in Haldimand, Norfolk, there's a hospital that's had to shut down some beds because it's had it's lost staff. There's just good, solid reasons for doing it. And so I was surprised. Here at CHEO, I think they're 99.7% of all workers. I think if you adopt early and you work at it, you can get there.
The province says it would mean thousands of job losses, and I'll be honest, a lot of the descriptions was pretty broad and vague. Is there any proof to that?
No, there's no. Even what they were citing out of British Columbia was a newspaper article. There's no data behind it. There's no data behind what they're talking about in terms of job losses at schools or in healthcare. And if you look at the organizations like CHEO, like Queensway Carleton, like UHN in Toronto, other hospitals, now even long-term care, they're in the 98, 99% range when they adopt early. And then you have to do work because you have to help people build trust. There are some people who need more help building trust in vaccinations. And so you have to do that work to get there. And the people who've done that have been able to succeed. It would have been a lot better if the government just stood behind everybody and said, here's the rule. But they didn't do that. So it's kind of a patchwork of not leadership.
What does this message send to patients in Ontario?
Well, I have to say, I think it's the wrong message. I think there are a lot of hospitals who've done the right thing and organizations and gone ahead and done it, like CHEO and Ottawa Hospital here. And so I think people can have some confidence. It's not that way in every hospital across Ontario. There are a few that haven't adopted that. And actually, the Hospital Association said, look, we need to do this because we need to do it all across all healthcare workers because, getting people moving between settings it's not safe for people. And as I said earlier, and it's just, I think we all have that reasonable expectation that the person who's caring for our one close up in healthcare, that they're protected and they're protecting, our loved one. And and look, almost 90% of people are vaccinated in Ottawa, or over 90% of people are vaccinated in Ottawa. So the vast majority of people, I think, are all doing the right thing, and they want their government to do the right thing.
I wonder, is this going to create a problem in the workplace, where you have most vaccinated healthcare workers, and let's face it, they could likely not want to be around the unvaccinated ones.
Well, that's actually the thing that doesn't get talked about as much, is that it's a health and safety issue. And so you'll find that that a lot of unions are doing what they can to get everybody vaccinated. They're supporting mandatory vaccination policies because, you want to know if the person beside you is protected and is protecting you. And so, I think it's a reasonable expectation for people to say, if you're working with me, I want to know whether you're vaccinated or not vaccinated. I mean, it's not that it's an American example, but I think, not to bring up football, but Aaron Rodgers, it's just, man, I mean, come on, I know that's not necessarily a good healthcare example, but I think it's what people expect, and people, and when that happens, I think in a workplace, people are, pretty disappointed, and look, here's the other thing, we have to come through this together. So we have to help people get there. It's not like, like we have to help them build trust. And that's what's happened in a lot of places, that they've done the work they need to do to help people get, that the people who are hesitant, you're always going to have people who are going to be, I'm not going to do it. And it's not, you're not going to convince them.
The province wants to use testing to replace vaccines for those who don't want to be vaccinated. I wonder, first, is there enough tests available? And secondly, should those workers who won't get vaccinated pay for those tests?
Well, look, I think there's enough tests available. I think in where we work, in the Legislative Assembly, if someone is not vaccinated, an MPP, they have to pay for their own tests. And so, I think here's the other thing: is surveillance is good, but it's not. It doesn't compare to vaccination. We had surveillance in healthcare, in long-term care, in the second and third wave, right? Before everybody was vaccinated, they still had outbreaks. Like, it's not it's helpful, but it's not being vaccinated.
I wonder, when I look at the Ontario Hospital Association, I think they report 120 of the 141 are for or have the mandatory vaccine policies. I'm wondering, does this create a two-tier system where patients are only going to go to a hospital with the policy they like?
Mm-hmm. That may be the case, and that may be the case, and people may shift jobs to go and work in a place where, so there's, so it's not just the hospitals though, because it's home care, it's and long-term care and other clinics. It's about anyone who's working closely with somebody, with them, to provide them with medical support. They need to be vaccinated. It's that simple. I think that's, and I think that it's simple because it's the right thing to do and the evidence shows it. But that's what people expect. That's what our family expects. I think most families would. I think if you had somebody who was helping your mom or your dad in a long-term care and they weren't vaccinated, I think people would be very concerned about that.
Oh, yeah. I can tell you that. John, I want to thank you for joining us.
Yeah. Well, thanks a lot for doing this show. I think it's really important that we talk about vaccines and making sure that we all do what we need to protect each other.
John Fraser is the MPP for Ottawa South and the Liberal House Leader at Queen's Park. The decision to fire healthcare workers for not being vaccinated has raised some ethical concerns. Carrie Bowman is a bioethicist and assistant professor in the School of Environment, Faculty of Arts and Science at the University of Toronto. And he joins us now. And Carrie, in terms of the vaccine, and I'll qualify the question that some people do have a real reason for an exemption, but for those who don't want it, you still feel uncomfortable firing them from their healthcare setting. Why is that?
Yeah. Look, let me take it from the top. I mean, I'm a healthcare worker myself. I've been working in, the Toronto teaching hospitals for many years. I actually do believe there is an ethical obligation for healthcare workers to be vaccinated. I appreciate people's profound concerns that some have, but I would argue the safety and well-being of patients really does supersede that. But look, having said that, firing is such a drastic thing to do. And the tone of it has been extremely aggressive in many, many cases. I find there's a really heightened element of intolerance to it, and kind of a pile-on, gang-up effect. Like it's kind of open season to really turn on unvaccinated people. I don't think that's a good thing for healthcare to be doing, to be so categorical in its thinking. And, several healthcare workers have come to me with deep concerns. Are they crazy? Are they extremists? No. I mean, there may be some, I don't know, but most of them have deep doubts and concerns. So I'm very concerned about the way it's been handled. But I would also argue that I do think there is an ethical obligation, but the aggressiveness of it and, the black and white thinking has been very destructive.
You mentioned tone and how that seems to have changed, the piling on. At the beginning of the pandemic, I don't think we would have seen it, but we're in the fourth wave. There's chatter of a fifth. People are tired. People are real tired. I guess you do appreciate that. Patience is at a limit.
It is. And, I would say this, Ed, I see a huge distinction between, and, we don't have the perspective yet. We will in the years ahead, but we don't really have it now. But, the first year of the pandemic, just building on what your comments already, it was, I'm not going to say a love-in, but, you might remember the first months, we're all in this together, which was never entirely true. People singing opera from balconies and things like that. Year two has been very, very intolerant and of great concern. And I worry about that because, we have a healthcare system in Canada where not exclusively, but primarily it's grounded in the free will and choice of the individual patient. And look, in some cases, the individual patient could be a healthcare worker. That really has been pushed aside. And, I think our politicians, hospital CEOs, some, not all, but some media people doing commentary or columns, it has made people sound very strong and decisive to have zero tolerance for unvaccinated people. But look, I would say this story is not over yet either. I mean, there's going to be more twists and turns ahead with this pandemic, and we don't really know historically what this is going to look like until we're well out the other side.
Yeah, I totally agree. It's we still haven't got the complete picture yet.
Yeah.
You feel there's not much understanding for those who remain unvaccinated. How so? Is it just the tone?
Nobody's that interested in why they choose not to be vaccinated. When we looked at people that had vulnerability, and this is real vulnerability, racialized people and their lack of trust within the system. Fortunately, we've shown a lot of identification, or maybe not identification, but acceptance of that. Sometimes healthcare workers, the reason they're not vaccinated is their experience with healthcare. It may be positive, but they're very concerned about the role of market forces in all of this, and there could be factors they don't understand. And look, I'll tell you, I know 3 women that have come to me and said, all in the first trimester of pregnancy, and yes, COVID's a huge risk with pregnancy, but all 3 of these women in the first trimester of pregnancy saying, I do not feel safe or comfortable taking a vaccine in these early weeks and months of a pregnancy, and I'm going to lose my job for it. And nobody's even asked what their reasons are.
Do you think that's part of the problem? They're not asking the reasons. It's just,
well, they don't want to hear it.
Yeah,
is why they're not asking. Yeah, I mean, it's the categorical thinking. The other thing that concerns me is, I worry that health could, we all would agree by now, I think, that the pandemic will leave a cultural shift. What that cultural shift is really going to look like remains to be seen. But what worries me is that the choice of the individual to make a free and informed choice related to his or her health may really, really be pushed aside even post-pandemic. We're getting into a mindset of we will decide what the best healthcare decisions are for you, and we will tell you what we expect you to do, which is very different than free and informed consent. And I worry that may have a lasting legacy in our healthcare system.
I wonder what's going to look, the healthcare system's going to look like. Obviously the Ontario, Quebec go against the mandatory vaccinations, and you got vaccinated healthcare workers, and how are they supposed to approach working with the unvaccinated? They could consider just leaving the business altogether because they don't want to do it.
No, and that's true. That's true. And the problem too will be for the average person, the average patient. Because of the situation in Ontario and Quebec. Now, a lot of hospitals have mandatory, but if you start putting patients in the position where very sick and vulnerable patients, that they actually do not know whether the healthcare workers are vaccinated. And by the way, you're not able to ask, right? That's a privacy issue.
Yeah.
You can ask, but they have no obligation to answer you. So that's also very worrisome. But I guess I'm a bit of a peacemaker. But I really, the tone of it has been unnecessary, and I think reaching out to these people that haven't been vaccinated could have gone a lot better if we had a little more understanding. And also, the vaccines are tremendously helpful. There's no question at the prevention of serious illness and death. But they're not a firewall. They're not like some vaccines. They're not bulletproof. It does not mean that everyone inside an institution that's vaccinated, everyone in that environment is completely safe, whether it's a restaurant, a bar, or a hospital. It's a huge improvement, but it's not a firewall. And we're kind of acting as if it is.
The provinces say the reason they're going back on the mandatory vaccine policy was because they were afraid of losing thousands of healthcare workers in the system. And we've seen a lot of cancellations of whether it be cancer treatment, surgeries, that kind of a thing. Is that, do you buy that excuse or no?
No, I actually think it is. I think it's actually quite true. I've been speaking to people in the province of British Columbia, and they have really had some significant cancellations because of their policies related to this. Look, I think you have to be quite pragmatic when you're running healthcare programs and institutions, and it is a reality. This is not a good time. What a lot of people do is they see this as a war, and they see this as we're giving in to the enemy, and the enemy is the unvaccinated, and how dare we give concessions to the enemy? Not a good way of thinking.
Yeah, very, very confrontational more than anything else, right?
Yeah.
Yeah. Okay, if case numbers start rising again, are we going to, and well, even more dramatically than they are now, are you expecting a change of policy, or it'll be status quo?
No, and look, a change, good ethics is grounded in good science is what it really comes down to. So, let's hope not. But if numbers were to really, and the numbers aren't great the last few days, but, we'll see. If numbers do rise significantly, the epidemiological equation would change. The ethical equation changes along with it, because ethics needs to look at risk-benefit analysis. So, that then we may have to rethink a lot of things that we've done, and we really have to play to win. If in fact we end up with high numbers or potentially, God forbid, a fifth wave. I'm guessing that's not going to happen, but I stress the word guessing because I don't know.
Mm-hmm. Yeah, I know. Carrie, I want to thank you for joining us. A very interesting perspective.
Yes, you're very welcome.
Carrie Bowman's a bioethicist and assistant professor in the School of Environment, Faculty of Arts and Science, as well as the Department of Medicine at the University of Toronto. Our unpublished .vote question asks you, should healthcare workers be vaccinated against COVID to keep their jobs? Yes, no, or unsure. You can log on and vote right now at unpublished.vote. I want to thank our guests today on the Unpublished Cafe, Ontario Liberal House Leader John Fraser and Carrie Bowman of the University of Toronto. And I want to thank you for watching the Unpublished Cafe. Stay safe. I'm Ed Hand.